there have been a lot of recent developments in metastatic renal cell carcinoma, especially this year and last year, groundbreaking trials that have been published starting in this year at ASCO GU. We had the Ipi-Nivo 30 months follow-up showing 11% complete response rate in the intermediate and poor risk group. Then we had the Keynote trial, axitinib and pembrolizumab combination showing a hazard ratio of 0.53, so really impressive data, overall survival benefit for the combination IO, in this time pembrolizumab and axitinib. So it's going towards combination therapy away from a single agent TKI to combination TKI and IO treatment, or an Ipi-Nivo combination, IO-IO combination. Another important trial was avelumab and axitinib showing a progression-free survival benefit of 13.8 months compared to the gold standard at that time, sunitinib. So on the horizon right now, it's happening a lot. A couple of weeks ago, axitinib and pembrolizumab got approved in Europe for the treatment, first-line treatment of renal cell carcinoma, regardless of the risk stratification, good, intermediate, and poor risk. Beginning of this year, 2019, the approval of Ipi and nivolumab in the EU, EMA approval was performed, so this is great for our patient and for us. And a week ago, we got the approval of, or the positive opinion of the EMA for avelumab and axitinib, based on the results that have been shown at this year's congresses, GU, ASCO, and also ESMO 2019. So here at ESMO 2019, there was again a piece of adjuvant treatment in high-risk localized renal cell carcinoma. So in other words, where you had localized T2 disease, underwent surgery, and there was a trial that looked at the use of sorafenib versus placebo in the setting, 1 year and 3 year follow-up, unfortunately showing no benefit of sorafenib. So we have now a lot of TKIs tested in an adjuvant setting, showing no overall survival benefit. So I think, in my view, the story of adjuvant TKI when you have no tumor is over. We will have to await the IO studies that are running right now. We have a lot of trials with nivolumab, pembrolizumab, that are looking at adjuvant IO treatment in the high-risk localized renal cell carcinoma. So I think this might be the future, but we haven't seen the data yet because the trials are still running or still under recruitment. So also in 2019, starting at ASCO, but also now here at ESMO 2019, there's a lot of discussion on the value of biomarkers and PD-L1 status in advanced metastatic renal cancer. But not only the PD-L1 status, much further investigation was performed in advanced renal cell carcinoma to correlate this data with response, with duration of treatment, with progressive data. And so there is a lot. There's no 100% clue. We know that PDL expression is of prognostic value. We don't know 100% how predictive those biomarkers are, but it's definitely the future to look in those panels of markers to help our patients with advanced metastatic renal cell carcinoma.